welcome back to the Eccles Business Buzz podcast. I'm your host, Frances Johnson, and I'm so glad to have you with us today as we wrap up our series of conversations with the Kempsey-Gardner Policy Institute's 2024 Informed Decision Makers. Every year, the Kempsey-Gardner Policy Institute at the David Eccles School of Business recognizes individuals and entities that contribute to the prosperity of our community here in Utah, often performing important work behind the scenes and without much recognition. Joining me today is Ross Van Vranken, the former executive director for the Huntsman Mental Health Institute, which is part of the University of Utah Health System. The Huntsman Mental Health Institute is a multi-million-dollar enterprise supporting a behavioral health care system anchored by a 170-bed acute psychiatric and substance use hospital. Huntsman Mental Health Institute serves all ages, disorders, and socioeconomic groups. Ross himself has been a leader in behavioral health dating back to the early 1980s. Ross's leadership and passion extend beyond his tangible accomplishments. How he leads amplifies his impact on others and the community, which is seen in his ability to inspire individuals and teams to foster an environment of inclusivity, collaboration, compassion, accountability, and innovation. Ross, thank you so much for being here with me today.
You betcha. Glad to be here.
Well, I'm going to date myself a little bit here and say that I also date back to the early 1980s. I was born in 1981, and I think the way that we talked about and thought about mental health when I was growing up, for example, in the 80s and 90s, is very different from the way that we think about and talk about mental health today. So as we start our conversation today, Ross, I'm hoping that you can walk us through how the paradigm around mental health and the conversation around mental health has changed and evolved during your time in the field.
Well, you're just a kid, so I can kind of help out with this. Yeah, I see it's changed dramatically. When I was first in this field, of course, people didn't even talk about it. There was so much shame and embarrassment connected with it. The families, individuals who had psychiatric needs would not talk about it, and really just shied away from anything that would actually insinuate that they had some kind of mental illness. I think a lot's changed in the last 20, 30 years. And, the advent of new treatments, new medications, better outcomes of all kind of aided in terms of people feeling more comfortable getting care and also seeing results from treatment, which has made a difference. But I think currently that, we're starting to see people really begin to tell their story. And I think we all recognize how powerful stories are. And so when people get out there and tell their story, I think it really helps inform others about really what is mental illness, and that it really is just another part of healthcare. It really shouldn't be kind of considered anything else. And it's really kind of opened up the dialogue between the community in general, and particularly the younger population is much more willing to kind of engage in conversation around mental illness and substance use disorder. Clearly, the COVID pandemic really emphasized the importance of mental health and really got everyone talking about it. And of course, the media coverage with all that has really kind of pushed it. And so it's just much different now. And then again, you look at the Huntsmans, how many families would put their name on a psychiatric hospital? And that takes a lot of courage to do. And so you're starting to see a new awakening in terms of really what is mental health, what is mental illness, what is substance use disorder. And I think the other piece of it, all of us know people in our lives or have people in our lives, whether it's ourselves, our family members, our neighbors, our best friends, who struggle with a mental health crisis at some point in their life. And so I think it's created a lot more a much more empathic understanding of this than what we had going back a number of years ago.
There's so many things I want to pull out of what you just said, but the first, maybe to help us set a baseline, Ross, is when we talk about mental health, mental illness, a mental health crisis. What are we sort of talking about? What falls under that umbrella when we think about what constitutes our mental health?
Well, I think when you're talking about mental health, you're talking about well being, that sense of well being. I'm okay. Uh, and I know how to navigate the problems in my life and I get through it. And I have an adequate amount of resiliency and reserve to take on struggles. I ask for support when I need it. I'm willing to talk about what's going on with myself. Uh, and that's really what it is, just that sense of well-being. That's what mental health is. And that uh, where you're able to engage in your life in a way that represents who you are and what you want to do. And so you could be active. You're a good learner. You're a good worker. You're a good spouse, family member. All those kinds of things. You can actually engage in that in a way that again sustains you. And when that all goes awry, everything goes in the opposite direction. So you hide out and you're not productive and you're not engaged in your life or uh, in the social network that you're a part of.
I think this is such a great definition because we might think of mental illness, a mental health crisis as something really extreme and bombastic, but we're talking about our personal wellness, our ability to engage in our life. And we all have probably experienced times when that was more difficult than others. So I think understanding it in this holistic way makes it more accessible and relatable to more people, which is part of this cycle of then people being willing to share their stories and talk about what's happening to them. I also really appreciate what you said, Ross, that mental health care is healthcare, right? We sometimes think of it separately. That's a different kind of issue. It's something that not everyone struggles with. But why but it is important to treat it just like we treat our sort of physical health care. Talk a little bit about that, the relationship between our physical health, our mental health, and why it's so important for us to think about and talk about and take care of our mental health in the same way that we take care of what we think of as our physical health or body health.
Well, our mental health and our physical health's all in the same body. So uh, that's a start. Really, the interplay between our mental health and our physical health is so linked. And uh, to the extent that if you have poor physical health, you probably struggle with mental health. If you have poor mental health, you struggle on the physical side. We have a lot of data now in terms of coexisting conditions and uh, the cost of it, for example. So if I have diabetes and a mental illness, the cost of treating my mental illness is about twice as expensive it would be. So the interplay is pretty significant. It's you'd have to go back historically to look how this happened, but mental health got carved out of physical health, and that was really a product of discrimination and stigma. It was the fact that these things aren't real, and somebody else will take care of them. And a lot of that came about with employer-sponsored health care and insurance, and even today, it's still carved out within insurance companies, which is just bizarre. And so the whole thing in terms of trying to integrate is so it just is you just have healthcare and mental health's part of healthcare. And
Yeah, it does seem that this separation, saying your physical health is one thing, your mental health is another thing, is, as you say, a contributing factor to this stigma, this reluctance for people who need help to seek it when they need it. And there also is an accessibility issue, right? I actually was just listening on the radio to a member of the Biden Harris administration talking about this new legislation that they're working on. And part of the problem of parity is this access issue. So maybe mental health care is included in your insurance plan, but there's no provider with any time or any space in their practice to see you. So, talk to us a little bit about the access issue. And I'm especially interested to hear, sort of, in the creation and the impetus behind the Huntsman Mental Health Institute in particular, if increasing access is part of the mission of that organization.
Yeah, yeah, it's critical. Yeah, access is a problem. That again is the structural strategy, if I may use that. I'll probably get in trouble. By the way, I'm not representing the university on this. This is my opinion. Yeah, I could spend a lot of time going back on the history and how this all happened, going back into um, President Roosevelt in 1943 actually creating sponsored healthcare by employers. Anyway, what we've had is really neural networks and phantom networks, where in some cases people, uh, frankly, were no longer with us. They moved out of state. They presented these to employers, and they think they've got a really nice network, and they don't. And so that's part of what they want to take care of in this legislation is these narrow, circumscribed networks that actually protect the insurance company, if you will. And I suppose you could say the employer, but I don't think employers are really aware of all this that much. But so that's part of it. I think the biggest challenge now with access is what happened in COVID. Now you have the world all upside down for all of us. Everybody's scared. People are at home. They're isolated and drinking more. They get depressed. Everybody now wants treatment. Where do you go? And most people don't even know where to go if they want to access care. And and that's been a problem. At the same time, while we've been working on normalizing this for the last 10 years, which is the right thing to do, and what we're talking about, where everybody's very comfortable about it, and if you have an issue, you just go get care. Where do you go? We don't have a workforce. And part of that, again, was a product of the structural. How if you limit the number of providers on a network, then you don't have access. What's happened pre-COVID, and particularly with these high deductible plans, and you've seen a lot of therapists, a lot of people who work for the state, work for organizations, go into private practice, self-pay only, work from home. And that's one of the things we learned that was really helpful in terms of creating access in COVID was doing teletherapy and teletreatment, which is really pretty effective. And so people moved into that. At the same time, you've seen states, California, Nevada, Utah, pass legislation where they want a social worker or psychologist in every school. So you've got all these things going on in terms of siphoning off providers, particularly on the public side. And that's created a lot of problems in terms of access and queuing to getting the treatment. Sometimes trying to get an outpatient treatment can be, a 4 or 5 month process. And of course, when you need care, you need care, right? And when you're motivated, and a lot of people lose that if they have to wait too late to get into treatment. So a lot of problems with that. As one of the reasons last legislative sessions, Jeff Shumway pushed through legislation for relicensings where we could actually license peers, case managers, bachelor's level people so that we can begin to tier. Not everybody needs to see a licensed therapist, and so there's a lot of momentum around workforce development and how do we do that. And the university actually is the only one in the state now, but the other universities will be doing it, trying to create a certificate for bachelor's level people to be able to work with a therapist as an extender so that we can create more access. So there's a lot of work being done on that. But yeah, we need a much bigger workforce than we have. And so it's a legitimate problem. And
What do you see as the role of the Huntsman Mental Health Institute in particular? I'm curious if you know anything about the history of that organization or what the impetus was for creating it, and is it part of alleviating this access problem? I know we talked in the introduction about this acute care that is available, but I think there's more than that. So talk about the role of the institute, sort of where it came from and what gaps is it filling?
it came out, we had discussions. This is when I was the executive. We'd had discussions with husband family members for a while around the Institute. Uh, John Huntsman's legacy is cancer. The 9 children looked around and they've had mental illness in their family and substance use disorder in their family. And they wanted to make this their legacy to actually change mental health on a national level across everything, including looking at policy reform on a federal level, payment reform, access to care, uh, best practice, specialty, personalized care, all those kinds of things. Uh, and a big part of that, so what they're funding right now is this Stop Stigma campaign, which is a national campaign that's intended to go out the next 10 years. And you'll see, I worked with the Ad Council to put out these PSAs on Love Your Mind. And so they have over 300 organizations, virtually anybody you can think of, all the sports, NFL and NBA, all of the sports folks, all the regulatory uh, agencies and associations, professional associations, everybody you can think of, and then working with the Kennedy Foundation for. So they're very invested in changing the whole thing because they want mental health to be totally different, just like we were talking about. Absolutely integrated into healthcare, full parity, uh, get rid of all these barriers for people getting care. And also part of that's just what we were talking about, creating an effective and scalable workforce to be able to kind of uh, get people into care fast.
Um, it's just so good for us to remember that nothing about our minds or our bodies happens in a vacuum, right? One thing that's been so interesting as we've had these conversations with decision makers is how ultimately everything is related to business. Everything is economic in some way, whether it's renewable energy, whether it's bicycles and access to transportation. These all have an impact on our personal economic vitality and the economic stability of our broader community. Talk to us a little bit about that, Ross, as we think about mental health, not in a vacuum, but integrated with everything else that we do. What are the economic impacts on people individually and on us collectively when we leave mental health sort of unaddressed?
Yeah, it's a big deal, and I think you've probably seen some national statistics on it in terms of how much it costs us just on the suicides and losing workforce that way from an economic standpoint at a national level. Yeah, individually, this impacts families. Uh, if you're really struggling mentally, you're not engaged in employment. And you take a lot of FMLA, you're sick all the time, you lose your job, you don't have income. You're just not very productive. And so from an employer standpoint, you lose productivity. And so here you are paying a whole lot of money and not getting much out of it. So it impacts everything. And good mental health represents a good economy. Yeah. If everybody's feeling good and engaged in what they do, and this same thing with learners, if you're a student, you can't learn if you're depressed or so anxious you can't concentrate. And that's true of adults too in the workforce. So it caught, yeah, I'll say this, and it's the absolute truth, and it drives people nuts when I say it, but it's the truth. The only way to save money on mental health is to treat people. If you treat people, because we can get 80% of people well within a fairly reasonable amount of time, and it's only that 20% that have kind of the chronic, reoccurring kind of illnesses that really require more management than effective, uh, treatment or outcome treatment, where somebody's going to get well and be okay in 3, 6 months, a year, year and a half, or whatever it takes. But so that's the critical piece of why I really believe in treatment, because I've seen it work. If you don't do that, you see disintegration in the family, you see disintegration in terms of social context and community involvement, and you see deterioration in terms of the economy and a whole lot of costs that you don't need to incur. If you can treat people early on, they don't need to be in a hospital.
I think it's a classic example of trying to save money up front and costing yourself more money down the road, right?
Yep.
And that applies almost everywhere. You make something cheaply, but then, right, you're paying to fix it later, or you buy something cheap and then you're paying to replace it. It's true with our like body health too, right? I don't go to the doctor for 10 years because and this is I mean, we could get into this too, and that can be a structural issue, right? If maybe I can't afford it, I have a high copay, whatever. But let's say I'm just putting it off because I don't want to do it. And then I end up very sick or very injured. And now I have a much larger cost than I would have if I had just taken some preventative steps in the beginning. So I think I hear you saying that mental health care is sort of catching up to what we know about other types of care. That's exactly right. I'm so glad that you mentioned students because this is a big focus at the Eccles School. A focus of our new dean is really this um, idea of wellness and of belonging, right? So we're talking about mental health care from the perspective of sort of managing symptoms and factors that contribute to symptoms, which you've mentioned, including food insecurity and housing insecurity, but also a social environment that promotes wellness. So a place where students feel like they belong, regardless of what background or circumstances they're coming from. And there certainly is a connection between our social environment and our mental health as well. Can you talk a little bit about that? What's the role of those social factors also in supporting our mental health?
Well, it's critical. And yeah, it's from an economic standpoint, if you're really going to prioritize where you put your money, it's in the 10 to 24 age group. 75, so see, the mental health's the number one disability in the world.
Oh, wow.
Part of what contributes to all that, as you know, is the whole social environment, particularly kids. How do you interact with your peers? How many people get bullied, isolated from the rest of the pack, don't feel like they belong uh, early on, and how that carries through. So creating an inclusive environment where people just get accepted for who they are and they can be a part of the overall social contract without having to be the popular kids or whatever. You can be whoever you are and fit into that is a critical piece. And of course, we all know that there are these different benchmarks that really require a lot of resiliency, going from elementary into junior high to high school to college, and that. And so, yeah, it's a critical thing. The more you can do to create that kind of wellness environment and inclusivity of everyone, the better, because we're social animals. And what contributes as much to mental illness as anything is isolation. And we all know the worst, I don't know about you, the worst thing I can do is be in my head,
Yes, I
And
agree.
if you're alone at home, you start making up stuff that ends up, you think it's a big deal. And of course, in the light of day, it isn't. And so that isolation really creates problems, and particularly uh, if you feel like you just don't belong and you shouldn't be there and all those kinds of things. So I'm glad you're working on that. I think that's a critical piece. If you want a really healthy learning student body, you've got to have good wellness. And, and from an economic standpoint, that plays in everything. You have better graduation rates, put people out to be productive workers in the community. You bring in new people. The whole thing is just critical in terms of everything we do from an economic standpoint and a workforce standpoint in the state.
Well, Ross, we've mentioned several times the Huntsman family, this great investment that they've made in mental health care here in the state of Utah, and their personal passion for that, their mission and their legacy, which I want to just echo what you say. We're so lucky and we should be so grateful to have that here, that they're willing to step forward into this uncomfortable space and put their name on it and really do some hard work to help us all. I'd love to hear from you, Ross, where your passion for mental health came from and why it's so important to you and to your life and career.
You know, I really, from my family. So I grew up in an immigrant family. My grandparents came to this country, and they created the kind of health food business here in Utah. So my grandmother had a retail health food store. It's called Stay Well Health. It was on Third South between State and Main. There's now a parking garage there. And then my grandfather had a factory down off of 50s and Senate Sound, and he made all the juices, carrot juice. So he did, all this kind of stuff, and sold it to all the health food stores, and then this guy. But my grandmother was a fierce advocate for health, and it was not uncommon to come home from school and she'd be on TV up at the city council pushing something. And Jay Brackenlee was the mayor of Salt Lake back when I was a kid, and you'd go to her house and he'd be sitting there. She was very community focused around health and well-being and all the kinds of things we're talking about. And I think that's what got me going. And since with the business school, I started out as a business major.
Excellent.
And when I got my junior year, I started taking some psych classes. Well, I really liked it. I changed my major and I went into social work and a bunch of stuff. And the irony of it, and then I ended up being the executive director of this hospital system, which is mostly business, right? So anyways, curious.
Come back anytime, Ross. Come
Yeah.
back anytime.
So, but I think that's where I got it from, just trying to make a difference in the world and help out where you could. And so I think that's what we got. And then when I was in my 20s, I lived outside the country for a while, and I got to see, got a totally different perspective on the world and what's, and a really kind of a clear understanding that kind of everybody kind of wants the same thing. They want to be safe. They want to have a productive life. They want their kids to have a better life, and that basically people are good. And I know that's hard to keep track of sometimes with what's going on in the world, but they really are. They're just the basic people. And that really influenced me, I think, in terms of just understanding human behavior and kind of what's important to people. So yeah, I'm very passionate. I have a hard time totally retiring because I'm still very passionate about all this stuff. So
How do you talk to people who are skeptical of mental health care? We've talked about the stigma around asking for help, talking about your own experience seeking help. I think it is, as we've talked about a little bit already, getting better, getting less. I have mental illness in my own family, and certainly, um, 20 years ago when we were sort of in the thick of that, I remember my parents kind of looking around and saying, there's no one that we can talk to about this. No one is talking about it, but it seems impossible that we're the only ones
yeah,
having this experience. And as time has gone on, people have opened up. All that to say, I think it's getting better, but there is certainly still skepticism and stigma around mental and behavioral health. So, how do you address that when you come up against that? What's your pitch?
I I think it's not as scary as you think, and we have good treatments. There's still people who are anxious about going to a psychiatrist or a therapist. And so I talk to those people, go to your primary care clinic. So what we've done in the university system, in the 11 clinics, we have what's called collaborative care, where we integrate behavioral health in the clinic, and they actually work for the physicians and the treatment part of the treatment team in the clinics. And so we have social workers in there doing that, case managers doing follow-up from the community clinic side, and then we have our residents and psychiatrists in there. So there are ways, if you're still a little squeamish about it, to still get treatment. Go to your primary care. Intermountain Healthcare has collaborative care now, and there's some other places. So there are entry points, and this gets back to the access. Uh, and they can screen people who and try and get them in treatment if they need more advanced treatment. Now, but a lot of it can be treated in the community centers. But we have really good treatments. I talk about our success rate in terms of treatment, and try and worry about psychotherapy. What does that mean? And all the drama. How that's all been portrayed over the years, mostly in comedies. But yeah, and it really is. It's interesting. We spend our entire lives doing all this other stuff. How much time do you really spend on yourself? Getting to know yourself. And really, if you think of that's what psychotherapy is all, talk therapy is about. It's kind of learning about yourself. It's getting all these secrets out in the open that have been binding you up, uh, to put them in perspective, and in some cases let them go, and all those type of thing. And it's really a healthy thing. And it's almost like, how many people like to go get massages? This is kind of a mental massage, if you want to think about it that way. So I think it doesn't have to be a big, scary thing. And I think people are reluctant to go in and tell everybody what's going on. And uh, but it's a really healthy thing to do. So, and even if you're just struggling with stuff and questions and things aren't going well, so before you get into actually having symptoms, go talk to somebody. It's really relieving. So
I love what you say that it's a healthy thing to do, just like it's healthy to get your annual wellness, to get your vaccines, to get your haircut, right? To take a shower in the morning. All these things we do to take care of ourselves. This is just one other
just
healthy
one other
thing to
thing,
do.
yeah, yeah. And you know what? Most most therapy is, most people can get by with 4, 5, 6 sessions. It's not that expensive when you put it in contacts, everything, even if you had to pay for it. So, yeah.
And a great reminder, I think, also to share our stories, to be a little bit brave, to say, oh, this happened to me, and this is how I dealt with it. This is how I am dealing with it. To put more faces in front of something that might be hard for people to understand or hard for people to accept. We might have to step into a little bit of uncomfortability ourselves, but the payoff is so much bigger. Well, Ross, when you think about a world where we all are well, I love what you said about right living outside of the country and realizing we all kind of want the same thing, and that is to feel well and to feel good and to feel happy. When you imagine a world where everyone feels that way, what does it look like? What does our community look like? What does our economy look like? What does our country look like when everyone
Well,
feels well?
if everyone kind of did the right thing and got help earlier, we wouldn't have any psychiatric hospital. We'd be out of work. Uh, so that'd be a good thing. So, I'm being a little facetious. I think what you would see is you'd have uh, better learners, you'd have stronger workforce, uh, a much more productive workforce. You have stronger social fabric in terms of people's engagement within their communities, uh, and you would have a better sense of well-being where people weren't so anxious and frightened, and also a population that had a lot of resiliency uh, in the tank, and when challenges came up, they'd be able to kind of work their way through them as opposed to collapse because they had nothing left. So something like that, it'd be paradise.
I was going to say, it seems like a place that we would all want to be. And I mean, not out of the realm of possibility, something that we can all be part of working towards as well.
We should define this as paradise is just around the corner.
I love that. I think that's a perfect place to end. Ross, I'm so grateful to you for sharing your personal experience and your expertise with us. Thank you for being here today.
Okay. Thank you. Love the Gardner Institute. You guys are incredible. Thank you.
And thank you for tuning into this episode of the Eccles Business Buzz podcast. We'll be back in 2 weeks to kick off our next series of conversations, this time about the impact AI has on the way we live, work, and even play. There are some really great discussions ahead, so make sure you are subscribed to Eccles Business Buzz wherever you listen to podcasts, and invite a friend or fellow alum to listen with you too. You can also follow us on Instagram at Eccles Alumni for all the latest news from your Eccles Alumni Network. Until next time. Eccles Business Buzz is a production of the David Eccles School of Business and is produced by University FM.